Plus, new details about the two cruise ship passengers being monitored at Emory after a hantavirus outbreak. And that is where we begin tonight. Good evening. Thanks so much for streaming 11 Alive. I'm Jennifer Bellamy.
And I'm Cheryl Preheim. We continue to follow the status of two patients brought to Emory after disembarking from the cruise ship that had the deadly hantavirus outbreak. One of those patients, who had mild symptoms after possible hantavirus exposure, has now tested negative.
The U.S. Department of Health and Human Services confirming that hours ago, but now that person, along with a close contact who was exposed, who is not showing symptoms.
11 Live's Gilad Malamed is live outside the hospital. Gilad, what happens next for these two patients?
The hospital today hasn't said how much longer the patients will remain here, but we do know that a hospital in Nebraska where 16 other exposed passengers are being quarantined is prepared to keep those people there for 42 days if necessary. I spoke today to a professor of epidemiology at Emory's Rollins School of Public Health, and the first question I asked her is, what is the risk to people in Georgia? She says unless you were on that ship, the risk is extremely low. Two passengers here at Emory arrived in a medical convoy yesterday. A big difference from two Georgians who were on that same ship and are at home being monitored by the State Department of Health. They left the ship in late April. I asked Dr. Jody Guest why we're seeing this contrast.
Important to note the timing of the differences for this. So the original people that disembarked were doing so at a time when it was not well known what was happening on the ship. And that is the first group that disembarked. They are currently being tracked appropriately by all the state and local health departments for those who are in the United States.
She says by the time passengers disembarked this weekend, health officials already knew they were dealing with hantavirus, so cases were handled differently. And it is important to note I got an update from DPH today saying that those passengers at home do remain asymptomatic. Dr. Guest says that while hantavirus is rare in the U.S., it's important to note that one big difference between this and COVID is that doctors and health officials are already familiar with hantavirus. It's not new like COVID was, so they do know how to deal with it. Live in Atlanta, Gilad Malamed, 11 Alive News.
All right, Gilad, thank you. And tonight, as many of you are getting ready for summer travel, we are asking experts about how you can prepare safely. This outbreak first happened on a cruise ship, so there may be some concern if that is still in your travel plans.
Earlier today on our 11 Alive 24/7 stream, we spoke with one health expert who says you should actually be worried about some more common illnesses.
Reports about hantavirus are certainly alarming, but actually there are other health threats that are much more common and likely to be expected when you're traveling. So for example, if you're going on a cruise ship, the most common illness is actually norovirus, which causes gastrointestinal symptoms, so that's diarrhea and vomiting. And the best way to prevent that is to wash your hands frequently with soap and water. If you don't have access to soap and water, to use hand sanitizer regularly. That's going to be your best bet to prevent illnesses while you're traveling. And you can also wear masks if you're feeling ill to protect those around you.
So some simple tips: wash your hands frequently, and if you're not feeling great, remember, maybe grab that mask.